Hey, Kathleen here. Hey, I mentioned that I was going to talk about this bonus thing that I had done. It doesn't really have to do with Marpe. It does have to do with airway health, though. So, about 4.5 weeks ago, I had my tori removed from the bottom of my palate. So, just bone growth that had happened from clenching and grinding over the years. Pretty dramatic in my case, the bone growth. Some people have it on their top, but I had it on the bottom. So, basically, I went into the oral surgeon. Just didn't eat ahead of time because you're going under a local anesthesia, kind of like what you would have for a colonoscopy. And I think what he did is like cut along the gum line, kind of peeled that back, got rid of the bone. He put platelets of mine underneath and then stitch it back. And then I could see the sutures up front here. So it's pretty much resolved at this point. I still have a little bit of swelling. It takes about 8 weeks, I think, for all the swelling to go down. So at the same time, he did a tongue tie release. So that was interesting because I hadn't planned on that. And luckily, I had gone to a myofunctional therapist the Monday before, knowing that even getting the tori out, I probably would have to do some kind of tongue work because the space was bigger and that kind of stuff. So during the procedure, he put me to sleep, had me lay down or laid me down, and then he did a scope from through my nose down to my airway to check my airway. It was closing at 90%. Did the procedure, removed the bony structure, the tori, did the tongue tie release, and then laid me down and did the endoscopy again, the drug-induced sleep endoscopy, and found that I had 60% of my airway blocked instead of 90. So that was amazing. And am I breathing or am I sleeping better? I'm still not. I still need to move the jaw forward. So it has helped in other ways. One thing that I noticed right away was I could smell more. So I could, for better or worse, I can smell more. After the Marpe suture split, right? Your bottom of your nasal floor opens up a little bit. I could breathe better. But with this, I can smell better. So that's an interesting tidbit. As far as the tongue tie release, he sutured that up. And I started meeting with my biofunctional therapist 3 days later, and I've been doing PT for my tongue ever since, every day. So that's been amazing. So, anything else to tell you about that? Basically, I would say 90% of my bottom is not swollen anymore. It was spongy after the first week, and I think that some of that was the platelets. He had me get in there with my finger and start moving some of that towards the gum line and just kind of rubbing. So a lot of that spongy bounciness would go away. And so now it's feeling a lot harder. That basically my palate, but the sponginess was kind of like a cushion, and he was saying just kind of move that forward. So I only took Advil, 3 Advil the first when I was done. Well, after I got home, and then acetaminophen, I just swapped, and then maybe down to 2 Advil, and then down to 1 Advil, and maybe at night for a couple nights I took something. But it wasn't bad for me. I spoke like I had marbles in my mouth. I did not have any infection. I did do the antibiotic for 3 days. I was a little nervous about that because I have had severe allergic reactions to antibiotics, but everything worked out well. Brushing was the hardest part because obviously you can't be brushing along your gum line. So I did the electric toothbrush on the top and then on top of the bottom teeth, but then manually did the fronts because the sutures are here. And then, well, they were poking through from the back. And then along the back, I was just really gentle, but I could see where that could get problematic if people aren't doing that well. They did give me a bag of sponges that I think I was supposed to use for the bottom and the back, but I never got instructions on that. So I didn't even know. You're walking out of the surgery. By the time I got into the car, I can remember that. That's the first thing I can remember. And I'm like, what's this bag of sponges here? And my husband's like, I didn't put them there. I'm like, well, I didn't put them there, but I probably did. I just don't remember anything from coming out of the office to the car. Even though they were telling me I was saying things and all kinds of stuff, I don't remember any of that. So hope that helps. If you have any questions, feel free to drop them in the comments.